Hello everyone, I'm Ingyin San.
I'm Khin Hsu.
And I'm Teresa. We're students from Sosan High School from Myanmar. In this video, we are going to talk about difficulties of taking COVID-19 treatment at home and situation of COVID-19 in Myanmar. The reason of this presentation is because we want to let everyone know the situation of COVID crisis in our country, Myanmar. We want to describe the difficulties of the people in Myanmar to the world. We also want to describe the plight of the lower classes because of the country's poverty during the COVID period. In third wave, even some of the rich people can't get treated because of the crisis of medical deficiency, so the poor can surely be treated. This is why people who were dead were mostly the poor people. Problem statement. In the third wave of COVID in Myanmar, people suffer from many problems of less or lack of medical supplies, high price of medicines and masks, high cost and less or lack of oxygen supplies and concentrators. They experienced lots of difficulties even to bury the COVID-19 dead bodies. During this time, all of the hospitals had many oxygen supplies and concentrator storage, but they are already full with patients. Because of panic buying and loss of high demands, all medical supplies related to COVID-19 went up so high. There are hundreds of people that are lining up to get oxygen for their friends, families, and relatives every day under the hot sun. So the people who waited for oxygen also become ill without immunity. And another difficulty is not being able to bury dead bodies. Hundreds of dead bodies were needed to be buried in a day. The people were lining up to bury their parents, children, relatives, and neighbors. Some dead bodies did not have their parents or relatives.
So only some officials looked after them. Some dead bodies didn't have coffin because they ain't enough coffin to put a dead body. Another difficulty is not being able to find doctors and nurses because some of them are participating in civil disobedience movement and some were still working under the new government. Methodology. 1. We ask permission to interview the participants. 2. We explain the aims of this study. 3. We interview 2 participants during 20 to 30 minutes for 2 times. 4. We ask open-ended questions. 5. We took voice recording by getting permission of participants. 6. We also note down on the book. 2 participants are middle-aged, 43 and 44 years old. One is male and one is female. Both of them took treatment at their home. Both live in Mandalay City, which is the second largest city in Myanmar with good healthcare system. Their occupations are monk and owner of self-microfinance. Hence, monk is a respected person and Myanmar people donated and supported him a lot, including financially. The other participants came from good socio-economic background.
One patient suffers more severe than the other, so he needs to inhale oxygen while the other doesn't need. He faced difficulties to get oxygen because he needed to inhale oxygen for 5 days. Firstly, he used electric oxygen concentrator. However, it didn't work so long. He needed to find oxygen tank at local humanitarian aid organization. His relatives had to crawl the whole night for 4 days to get 3 liters and 4 liters as each day. Both of participants did not experience that much difficulty because their families, relatives, and equipment have to find medicine. Some of them are from medicine fields such as doctor. Another condition is both of them are above middle socio-economic status. Therefore, the price of buying medicine is not a problem for them. Participants didn't have difficulties. One participant has a family doctor and he paid regular visits to cure her. Other couldn't find any difficulty because he could be treated by a pharmacist, a doctor, and a nurse. Both participants told us they didn't have so much difficulty for treatment cost. The treatment cost of the participant who needed oxygen is more than the one who didn't need oxygen. The total cost for oxygen the participant had between 8 million jets and 9 million jets. However, the other cost about 6 million and 7 million jets. In Myanmar condition, their cost of treatments cannot afford the poor people because the weight of heart liver in Myanmar province is 5,000 jets, so the cost of COVID-19 treatment is out of hand for lower class. It's not convenient for the people in ideal situation to buy mass medicine and oxygen tests in very high price, so we think that if people didn't buy and needed medicine, mask, and oxygen tests, people who actually need them will not have a very hard time. It's difficult to call patients because of poor internet and phone line. I often pause interview because interview participants are COVID-19 positive and they call during interview. The participants were interviewed by phone line, so phone calls is more than ideal. One participant finds difficult to communicate because she doesn't have her own phone. Some caregivers don't like to ask participants, so it's not convenient to ask for long. We could interview 2 participants because of limited time.